Hi, everybody. I am Sarah Hancock. I am the Communications Director at Community Healthcare System. We are based in Onega at Onega Community Hospital, but we serve 4 counties. I am here today with Erin Tynon, who is a Pottawatomie County Research and Extension Family and Consumer Sciences Agent. She is also a SHICK counselor, which means that she has had a lot of training and is an expert on Medicare Open Enrollment and your various options. And we know many of our patients and area citizens have an array of questions at this time of year because it's open enrollment time. So Erin, thanks so much for being here today.
Yes, thanks for having me.
So I have a nice list of questions to ask you today. So we're just going to work down these questions and let Erin give us some expert advice. So Erin, our first question is, we're all hearing that it's Medicare Part D drug enrollment time. And what does that mean and how do you do that?
So Medicare Open Enrollment is October 15th through December 7th. So that's coming up. This is a time you can log into medicare.gov and look at your Part D drug plan options for 2023. It's wise to check your plan options every year. Many things can change in the plans year to year. Even if you like the plan that you currently have, the changes that are being implemented in 2023 could change the content of the plan and what you pay for the plan very dramatically.
Great. So I introduced you as a SHICK counselor, and that's spelled S-H-I-C-K. And can you tell us what that means? What is a SHICK counselor?
SHICK stands for Senior Health Insurance Counselor of Kansas. Sometimes they're called SHIP in other states. These counselors are highly trained and certified to provide free, in-depth, unbiased, one-on-one health insurance counseling and assistance to Medicare beneficiaries and their caregivers. We do not sell insurance plans. We help consumers overview their plans and answer questions. And we provide many resources to help you answer those questions in regard to all aspects of Medicare. Our overall goal is just to educate and help you make an informed decision with your health care.
It's great to have that kind of impartial resource that people can use. So I hope everybody knows they can use you as a resource. So if I'm on Medicare and my plan was great for me this year, why would I want to consider changing to something new?
Yeah, there is potential that you may not need to change your plan each year, but it is good to always check. The details of your plan can change year to year, like I mentioned above. The price of the plan could change, or what's called the premium cost. The pharmacies covered under the plan could change. I know we do have some local pharmacies that drop some plans this year, and so that makes a huge impact in what's covered and what's not, as well as the plan coverage on different prescription drugs also change. And so every year that stuff changes. So it's good every year during open enrollment time to look at medicare.gov and kind of figure out what some of those changes are for you.
So what happens if I'm someone who doesn't take any drugs? Why would I want to sign up for a plan and pay a premium for something that I might not be using right now?
Yeah. So for every month after you turn 65, you get a 6-month window, 3 months before you're 65, 3 months after, to get enrolled in a Part D drug plan. But every month after that you do not have what's called credible drug coverage, so you're not getting in something from an employer that you're still working with or something like that, you will get charged what is called a penalty. And you will have that penalty. You will pay that penalty the rest of your life every month as soon as you get enrolled in a plan. So it is good just to get enrolled in a plan, even if you do not take drugs or you take very little drugs. There are plans that have super cheap premiums, and so you can pay something very affordable just to have coverage on a plan. So that's something that a SHICK counselor could help you look into, is what plan would work, that's very economical, considering I don't take a lot of drugs or I take no drugs.
So if I have changes in my plan for the next year, how am I going to know about those?
So if you're already 65 and you were already enrolled in a drug plan, you will receive every year, you should have already received it, an ANOC, which stands for the Plan of Annual Notice of Change, in the mail. Medicare mails those out each fall. The notice includes any changes in coverage, costs, and more items that will be effective January of the following year. If you do not get this document, I would contact your plan. The Medicare.gov website takes into account all the changes taking place in all the plans, and so that way you can look at all the different rates and find a cost-effective plan for yourself.
Great. What is the most inexpensive plan I can get this year? And what's the most expensive? And what is the difference?
So the premiums range for 2023 from $2.80, again, very affordable plan, up to $112.60. And there's a wide variety of reasons why there's cost differences in those. Generally, the more expensive plans have maybe a lower deductible. They cover more specialty type drugs. And so you're going to be paying a little bit more for those plans. It doesn't mean that the plan that was $2.80 is not a good plan. They still have good coverage levels for drugs, especially pretty normal drugs that people are on. And so it doesn't mean that it's a poor plan. It could very well be a good plan for you. That's the great thing about the Medicare.gov website, is it takes into consideration the cost of the plan, as well as all those other things, what pharmacy you want to use, what drugs you're on, and it pulls up the most economical plan for you.
So if some of the plans are too expensive and I don't have the income or enough Social Security to pay for it, what are my options?
So Extra Help is a plan that Medicare has for people that have limited income and resources. It helps them pay for Medicare drug coverage. You can automatically qualify if you receive help from the state paying your Part B premiums, supplemental security income, benefits from Social Security. And if once you apply, you'll get a letter from Extra Help, and it'll tell you how much that they will pay on your drug plan. If you don't automatically get Extra Help, you can apply for it. The income and resource limits are for an individual $20,385 and a resource limit of $15,510, or for a married couple, $27,465 or a resource limit of $30,950. What counts in a resource limit is money in checking, savings or retirement, stocks and bonds. Things like your home, your car, your burial plot, furniture, or household items do not count towards this limit. And if you're curious about Extra Help, you can always contact myself and I can kind of help you walk through the process.
Great. Erin, should my spouse and I be on the same plan for convenience?
I do have people come in here and say, I think I just want to be on the same plan as my husband. Unless you take the exact same drugs as your spouse, more than likely you will be on different plans, and that's okay. You want a plan that's very catered to you and your individual drugs that you are taking in the pharmacy that you go to. And so while it is kind of convenient being on the same plan as your spouse, unless you're on the same exact drugs, it's probably not going to be the most economical.
And I think you addressed this a little bit before, but can you tell us again, how do you know if your new plan covers the drugs you take and if your pharmacy is still accepting your plan?
So the Medicare.gov website takes all that into consideration, but it might be wise to call your pharmacy and just make sure that they're still accepting the plan that you're on, or the plan you choose to go to. That is something that we look at when we're doing a counseling session. We make sure that the pharmacy that you're going to, that it's still going to take those plans as well as the coverage on those drugs that you take as well.
So what if I'm not very tech savvy and I'm just not comfortable getting on the Medicare.gov website and that just seems overwhelming? What kind of help can I get?
Yeah, so I mean, that's a lot of people that walk in through my door. I walk people through the whole counseling session. I do kind of all the computer work for them. They just have to bring me their information, and then I can plug it into the computer and walk through that with them and help kind of guide them. I know it can be kind of intimidating, especially if you haven't worked a lot on a computer to navigate that website. There are changes to the website every year. And when we take our SHICK counseling training sessions, we kind of learn about what those changes are. So we're very trained to be able to navigate that website well.
So what kind of information does someone need to bring to a counseling session with you so that you can help them navigate that website?
So the most important thing they need to bring is their Medicare card. that will have their Medicare ID number on it, as well as their Part A and Part B Medicare dates, which we have to create an account for you. And then the other thing that's really important is a list of your current prescriptions. Those prescriptions, we need the dosage, the exact dosage that you take, as well as the frequency that you take them.
Okay, so pretty simple documents to bring to the session. That's great. So I see all this stuff on TV about Medicare Advantage plans. What are those, and do I need one of those?
So if you're living and breathing in this year and last year, you've probably been inundated with the Medicare Advantage plans on TV, on your phone, and the radio. I mean, they're pretty much everywhere. I get a lot of questions about what these plans are. They are approved private companies that must follow the rules of Medicare. Some Advantage plans offer Part D coverage, so they kind of are more an encompassing plan. If you have a supplemental or something like that, it'd be your supplemental sometimes plus your Part D. Some of them have dental and vision attached to them. In most cases, you'll need to use your healthcare providers who participate in the plan's network. So they're very stringent about only having in-network providers. And that's the challenge in some of our rural areas, is we do not have a lot of in-network providers within these plans. Each Medicare Advantage plan can charge different out-of-pocket costs. They also have different rules for how you get services, whether or not you need a referral to see a specialist, if you go to a doctor's facility or suppliers that belong to the plan for non-emergency or non-urgent care. These rules change every year. And like I said, the biggest challenge with these plans is finding in-network providers. Pottawatomie County and other surrounding counties have a limited scope of providers that actually accept these plans. So this could hinder you from getting the services you need or want in your local community. And you may only be able to get a provider in a more urban area if you need a specialty service like physical therapy. You don't have to drive to Kansas City or Topeka every time, every week if you're having, maybe some physical therapy for your shoulder. While the plans can be cheaper and they are more comprehensive, you may find that you pay a little bit more out of pocket costs in comparison to utilizing what's called a supplemental plan.
So I just want to echo what you said a little bit there. We've certainly seen patients of ours who have experienced problems with Medicare Advantage plans because they sign up and they sound like a great idea, but then they come and they find out that their preferred provider here at CHCS is not in the network, and then they're upset because they're not able to get their services here. So we have joined with some other hospitals in the area to purchase ads and do some communications that just stress that people need to call their preferred provider to check to see if they're in the network that they're considering when they're looking at Advantage plans. So we hope that people will either, get with you or call us or, call their provider to make sure that they're signing up for the right kind of plan.
Yeah, I always advise people, if they're really contemplating doing an Advantage plan, the first thing you need to do is call your primary care physician and say, hey, are you in network? And same thing, if it's a vision or has dental plans attached, you need to call wherever you go see your dentist and to make sure that they're an in-network provider for those plans. That's really important. I think it catches people off guard. And sometimes when people call the Medicare Advantage line, they'll say, yes, your area is covered under this plan. And that may mean that, one provider in the whole area is what's considered in network. And they may not be able to tell you that your provider is. So it's good to just make that personal connection with your in-network or with your providers.
That's great advice. And so tell us how anyone can make an appointment for a free counseling session and how to go about doing that.
Yeah, so I kind of mentioned before, I do counseling sessions in my office here at the Extension office in Pottawatomie County in Westmoreland. Our office is located at 612 East Campbell here in Westmoreland. Our phone number is 785-457-3319. I have designated days that I take appointments. in here in my office, and I'd be happy to sit down with you and do a counseling session with you. There's also the opportunity to have counseling sessions by calling the North Central Flint Hills Area Agency on Aging. They're located in Manhattan, and that's what, for Pottawatomie County, they're our Area Agency on Aging. They are the ones that hold the grant that train all of the SHICK providers in the area. They take appointments in their office. Their phone number is 785-776-9294. And then I know you guys have different service areas as well. So like Marshall County, for instance, and Nemaha County, I believe they're under the Northeast Area Center on Aging. Their phone number is 785-742-7152. There are there's an extension office in every county in Kansas. And I do know that Marshall County and Nemaha County, Wabunsee County, Riley County, we all have extension agents that help people enroll in Part D drug plans. So you can call your local extension office. They should be able to connect you with someone that will help take appointments if you're not located in Pottawatomie County.
That's great. Thank you so much. Do you have anything else that you want to add today?
No, I just I hope everybody gets their plan checked. It's really important. You can have very dramatic changes. I've seen some years when a drug went out of network, you could pay thousands and thousands of dollars each month for that drug. And you may have thought, well, it was covered last year, but it's not covered in 2023. So it is just really important to do those checks. And I can also do them, you know, if you're not comfortable meeting in person yet, I can also do something over the phone as well as Zoom, if you're into more virtual platform. So don't ever feel like, you know, you have to physically come to my office. We can always make some changes in the way that we meet and figure out how to work something that works for you.
Well, thank you for your time today, and thanks for offering this really important resource for people. We're grateful to K-State Research and Extension and all of the offices around the state that can help provide this resource for our citizens. So we will share this video, and we hope it's helpful for lots of people. So thank you, Erin.
All right. Thank you, Sarah. I appreciate you having me.
Bye-bye.
Bye.